This week's Ask Dr. Durie comes from a patient who has recovered from a COVID-19 infection and is doing quite well in the recovery phase. And the question is it okay to restart myeloma therapy when you have fully recovered from a COVID-19 infection? The good news is that we are seeing more and more myeloma patients who've actually recovered nicely from COVID-19 infections, particularly with the use of the monoclonal antibody therapy, which has been very helpful for a number of patients. What about the idea of restarting therapy? Well, I think it's something that we don't know the full answer to, but my suggestion is to defer restarting therapy for at least a month or two until you see that the recovery is progressing well. The other thing to be aware of is that before therapy is restarted, this could be an ideal opportunity to take COVID-19 vaccination. It has been noted recently that, for example, long haulers, patients who have continued to have some symptoms from the COVID-19 infection for weeks to months, can actually benefit from COVID-19 vaccination. In a recent study, around 40% of such long hauler patients actually had full reversal of their symptoms with the vaccination, which seems to boost the antibody levels against COVID-19 such that the infection is cleared from your system. And so something to consider before restarting therapy. In that 2 to 3 month time frame, I think it's reasonable to consider restarting therapy after the vaccination. But talk to your doctor, because depending on the situation, it may be that it's urgent to get started right back on therapy even sooner to make sure that the myeloma does not relapse. And so in this particular case, the selection of the treatment, the timing of the treatment, and these various very personal decisions need to be discussed carefully with your doctor and set up a plan for monitoring and retreatment when the time is best in your case.